Having understood the basic steps and positive pressure ventilation, let us now try and understand a scenario wherein advanced steps are required. A primigravida mother delivers a preterm infant at 33 weeks who does not cry at birth. The cord is cut and the baby is taken to the radiant warmer for initial steps. After initial steps, the baby has a heart rate of 70 beats per minute and is not breathing. Positive pressure ventilation has started, and even after 30 seconds of effective positive pressure ventilation, the baby is not breathing and the heart rate is 60 breaths per minute. How will you proceed now?
I shall hold the laryngoscope in the left hand, open the mouth with the finger and insert the blade to the base of the tongue. Lift the blade correctly, that is, there should be no rocking motion. Request cricoid pressure if needed. Identify the landmarks. Take corrective action to visualize the glottis if it is required. Insert the tube from the right side. Note, the tube does not have to be inserted through the center of the laryngoscope blade. Align the vocal cord guide with the vocal cords. Remove the laryngoscope and then hold the tube against the baby's palate.
Breathe 2-3, breathe 2-3, breathe 2-3, breathe 2-3. I shall observe for the chest rise, breathe 2-3, breathe 2-3, breathe 2-3, breathe 2-3. I shall also observe for the rising heart rate and the improving oxygen saturation. Breathe 2-3, breathe 2-3, breathe 2-3, breathe 2-3.
The heart rate is more than 100 beats per minute. However, the baby remains apneic. The oxygen saturation on the pulse oximeter is 72%.
I shall continue positive pressure ventilation and direct the FiO2 adjustment as per the target oxygen saturation for preterm infants.
Since the heart rate is normal, I shall now start preparing for transport while continuing the monitoring of oxygen saturation. And I would also like to update the parents.
The heart rate is about 40 beats per minute.
I shall call for additional help if necessary and ask the assistant to increase the oxygen concentration to 100% and then count 1 and 2 and 3 and breathe, 1 and 2 and 3 and breathe, 1 and 2 and 3 and breathe.
The heart rate is 70 beats per minute and rising. The pulse oximetry is starting to detect a signal. However, there is no spontaneous respiration.
We shall discontinue chest compression but continue positive pressure ventilation, and during this time we will adjust the FiO2 depending upon the target oxygen saturations.
The heart rate is more than 100 beats per minute. The oxygen saturation is 90%. The tone is improving and the baby is beginning to have good spontaneous respirations.
Gradually start decreasing positive pressure ventilation, keep on monitoring oxygen saturation and prepare for transport of the baby to the intensive care unit, while simultaneously I shall discuss and update the parents about the baby's clinical condition.
The heart rate is 30 beats per minute and not increasing. Pulse oximetry is not detecting a signal.
I need an emergency venous cannulation. Please give me an umbilical catheter, a stopcock and normal saline for flush.
Remember, the assistant checks the medication label, opens the medication.
I require adrenaline 1:10,000. Since the estimated weight of the baby is 1.5 kg, the adrenaline should be 0.15 to 0.45 ml.
Remember, the assistant checks the medication label, opens the medication, attaches the stopcock or the syringe connector and the 1 ml syringe. He also prepares the correct volume, labels the syringe with the medication name and the intended route, administers the umbilical venous catheter epinephrine, and announces intravenous adrenaline given.
Continues positive pressure ventilation and compressions.
The heart rate is 50 beats per minute, the pulse oximetry is not detecting a signal, and the baby appears pale.
Continues positive pressure ventilation and compressions.
Requests 15 ml, that is 10 ml per kilogram of normal saline through the umbilical venous catheter over 5 to 10 minutes using closed loop communication. Draws up the correct volume, ensures that the catheter is being held in place, attaches the syringe to the stopcock, opens the stopcock to the catheter and administers the volume in a slow infusion over 5 to 10 minutes without air bubbles. Also announces 15 ml normal saline given. The heart rate is 100 beats per minute and increasing. The SpO2 is 68%.
Discontinues chest compressions and continues positive pressure ventilation with higher ventilation rate, around 40 to 60 breaths per minute.
The heart rate is more than 100 beats per minute. The oxygen saturation is 80%. However, there are no spontaneous respirations.
Continues positive pressure ventilation, adjusts the oxygen concentration as per the pulse oximetry.
The heart rate is now more than 100 beats per minute. The oxygen saturation is 90% and the baby is beginning to have tone and some spontaneous respirations.
Continues positive pressure ventilation, adjusts the oxygen concentration as per the pulse oximeter saturations, prepares for transport to the special newborn care unit and finally updates the parents.
Remember, the key NRP behavioral skills include: know your environment, use all available information, anticipate and plan, clearly identify a team leader, communicate effectively, delegate workload optimally, allocate attention wisely, use all available resources, call for additional help when needed, and maintain a professional behavior. Thank you.